Assalamu alaikum. Hello my dear students. Hope you are doing good. I am Dr. Karim Rezwan Hasan, Associate Professor, Department of Anatomy, Ad-Din Women's Medical College, Dhaka. Today I will show you a video on the dissection of leg and dorsum of the foot. You know, in the anterior compartment of the leg, there are basically four muscles: tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. On the other hand, at the lateral compartment of the leg, there are two muscles mainly, peroneus longus and peroneus brevis. At the same time, at the dorsum of the foot, there are a lot of muscles, but mainly there are two individual muscles which are highly significant. That is extensor hallucis brevis and extensor digitorum brevis. We will see those muscles. At the same time, we will see the nerve and the blood vessels which are present in those areas. Remember, the muscles of the anterior compartment of the leg are mainly responsible for the dorsiflexion of the ankle joint. Not only that, some of the muscles are working on the individual toes, and in those toes they are doing the mainly dorsiflexion. At the same time, you have to know that peroneus longus and peroneus brevis, these two muscles are present at the lateral compartment. These muscles are mainly responsible for the eversion of the foot. So, the anterior compartment muscle that is present at the leg are doing the inversion of the foot. Inversion means when your sole is facing medially, and eversion means when your sole is facing laterally. So, not only the dorsiflexion or plantar flexion kind of activities happening in the foot, but also inversion and eversion is there. Now, I will show you a detailed discussion on the dissection of the anterior compartment and specifically the dorsum of the foot. Let's start. Over here we can see the leg portion basically. This is the lateral side of the leg, this is the medial side. Over here you can see the knee joint having the superior aspect, and this is the ankle joint, we will consider it as the inferior aspect. In the dissection, we usually extend the dissection of the thigh crossing the knee joint up to the upper 1/4 of the leg. We can see the dissection. Now, there is a transverse incision at the upper 1/4 of the leg. At the same time, there is another transverse incision at the ankle joint. So, then we will give a midline incision extending them, and ultimately something like this. Remember, the skin of the leg are very much thin, at the same time they are very much over the deeper structures. There are less amount of fat. At the dorsum of the foot, you can see we are extending the incision up to the base of the toes. Now, we are removing the skin along with the superficial fascia. The deep fascia has been removed. So, we can see over here, this is the tibia along with the structures. We can see at the medial aspect there is no muscles, that means medial aspect of the leg is subcutaneous throughout. Over here you can see this is the great saphenous vein. From our previous knowledge, we know that great saphenous vein is starting from the medial aspect of the dorsal venous arch. We can see that great saphenous vein is passing through the superficial fascia and it is going up. You know that great saphenous vein, whenever it is basically going at the medial aspect. First of all, it goes at the medial aspect of the medial malleolus, then it go upwards, it will cross the knee joint over here, and ultimately it will go into the inguinal region where it will pierce the saphenous opening and drain into the femoral vein. Another important structure over here you can see, this is the superficial nerve, and this superficial or cutaneous nerve is called the great saphenous nerve, and this nerve is arising from the femoral nerve, and this nerve is giving the cutaneous innervation of the medial aspect of the leg and foot. As you can see, it is going to the foot. Now over here we can see the detailed structures which is found after the dissection of the anterior compartment of the leg. Let us see. After removal of the skin, superficial fascia, you will see that this is the lateral aspect which is close to the posterior aspect, and this is the medial aspect. Now, if we see the structures, you can see a thin nerve fibers which is extending vertically and going to the foot. This nerve is the superficial fibular nerve or superficial peroneal nerve. Remember, superficial peroneal nerve is one of the terminal branches of the common fibular nerve or common peroneal nerve. Common peroneal nerve is another terminal branches of sciatic nerve. Now, this superficial fibular nerve or superficial peroneal nerve, this nerve is mainly supplying the lateral compartment of the leg. At the lateral compartment of the leg, there are two muscles, as I have already told you. One is peroneus longus, another one is peroneus brevis. At the same time, this nerve is supplying the lower 1/3 of the lateral side of the leg and most of the dorsum of the foot. You can say this is a nerve of the dorsum of the foot, except some part which is supplied by the deep peroneal nerve. Now, you can see this nerve is going over this retinaculum, which is the extensor retinaculum. So, this nerve is not only supplying the leg, but also it supplies the dorsum of the foot. Now, let us start with the muscles. You can see this muscle is the tibialis anterior muscle, a very long tendon over here. Morphologically, tibialis anterior muscle is a special type of muscle which is called the circumpennate muscle. The only circumpennate muscle present in our body is the tibialis anterior muscle. Tibialis anterior muscle having its origin from the upper 2/3 of the lateral side of the tibia, and it is inserting into the medial cuneiform and the base of the metatarsal bone, which is the first metatarsal bone. The main function of the tibialis anterior is the dorsiflexion of the foot, and also it is a powerful inversion of the foot or powerful inverted of the foot. So, we can trace the tendon which is passing below the extensor retinaculum. This is the superior band and this is the inferior band of the extensor retinaculum, and it is going medially and ultimately it is going to the medial cuneiform. Now, the next muscle over here, you can see very large muscle which is called the extensor hallucis longus. The name itself says it is hallucis, that means it should go to the great toe. The origin of the extensor hallucis longus is from the anterior surface of the fibula and the adjacent part of the interosseous membrane, and it is inserting into the base and the dorsal central part of the distal phalanx of the great toe. Remember, the main function is present in its name. That means it is the extensor of the great toe, and also it is doing the dorsiflexion of the foot. You can see this tendon is also going below the extensor retinaculum, the two bands of extensor retinaculum, superior band and the inferior band. Let us trace the tendon. You can see in between the bands, this is also the tendon of the extensor hallucis longus, and this tendon over here, you can see the cursor of my mouse, and it is going to the great toe. That means the first digit over here. Now, the third muscle is the extensor digitorum longus. Extensor digitorum longus, the name itself says that it is going to the other digits. Remember, this muscle is taking its origin from the lateral side of the tibial condyle and the proximal 3/4 of the anterior part of the fibula. The insertion of this muscle happens by splitting into 4 tendons, and these 4 tendons are going to the 2nd to 5th digits. Remember, the function of the extensor digitorum longus is extension of the 2nd to 5th digit and also dorsiflexion of the ankle joint. So, this tendon is also going below the extensor retinaculum, as you can see, and now these tendon are splitting into 4 tendon. Very clearly you can see that these 4 tendons are going to the 4 toes over here, that means 2nd, 3rd, 4th and 5th toe. You cannot see better than this, how beautifully these 4 tendons are splitted and going into the 4 toes except the great toe. Now, the last muscle of the anterior compartment of the leg is the peroneus tertius. You know, the peroneus tertius tendon is hidden by the extensor digitorum longus, but you can see the tendon over here. This peroneus tertius is present at the almost close to the lateral aspect of the leg, and it is taking its origin mainly from the extensor digitorum longus, from the medial part of the shaft of the fibula, and the insertion is happening at the dorsal surface of the base of the 5th metatarsal bone. The function of the peroneus tertius, as its name says, that it assists the extensor digitorum longus for the dorsiflexion, and also it helps for the eversion and the abduction of the foot. Remember, even this muscle is present at the anterior compartment of the leg, but it is helping for the eversion just like the other peroneus muscle like peroneus longus and the peroneus brevis. Just because these muscles, the peroneus muscles, are present at the lateral aspect of the leg and lateral aspect of the foot. That's why they are doing the eversion. Remember, this peroneus tertius is also important just because it is doing the eversion. Now you can see that it is inserting into the 5th metatarsal bone. Now we just zoomed in and we can see some other muscles which are present at the dorsum of the foot. I have told you that we will focus into 2 muscles. One is extensor digitorum brevis and another one is extensor hallucis brevis. So, after removal of the extensor digitorum longus, we can see that there are 3 small tendons over here. These small tendons are the tendons of the extensor digitorum brevis. The brevis means small. The origin of the extensor digitorum brevis is coming, or origin is taking place from the dorsal surface of the calcaneum, and also they are inserting into the base of the proximal phalanx of the 2nd, 3rd and the 4th toes. Remember, not all the digitorum are having attachment with the 4 toes. Some of them, like the extensor digitorum brevis, is having attachment for the 3 toes, and those 3 toes are 2nd, 3rd and 4th. That means excluding 5th toe. The function of the extensor digitorum brevis is extension of the toes, and those toes are 2nd, 3rd and 4th. So we can see this is the 2nd one, this is the 3rd one, and this is the 4th one, as you can see. Never get confused about the 5th one, because there are no tendons for the 5th one. Now, over here you can see another small tendon muscle is going to the great toe, and this one is the extensor hallucis brevis. Extensor hallucis brevis, the name itself says that this muscle has to go to the great toe. The origin is dorsal surface of the calcaneum, and the insertion is to the proximal phalanx of the first toe or the great toe. The function is the extension of the great toe. You can see the tendon is also going to the great toe. elongated tendon over here. Now these are the muscles which we have seen from the dorsum of the foot. Now let's see about the nerve and the vessels which are present at the anterior part of the leg. Remember, this is the nerve which is the common fibular nerve. This common fibular nerve is mainly coming from the sciatic nerve as a terminal branch. You know that the sciatic nerve is divided into two nerves. One is tibial nerve, another one is common fibular nerve or common perineal nerve. Now this common fibular nerve or common perineal nerve close to the neck of the fibula over here will be divided into two branches. One is superficial fibular nerve or superficial perineal nerve, another one is deep fibular nerve or deep perineal nerve. Now the superficial nerve, we already seen that it was passing at the lateral aspect and giving supply to the compartments of the lateral compartment of the leg. That means the muscle is peroneus longus and peroneus brevis, and this is the superficial fibular nerve, and it is also supplying the most part of the dorsum of the foot. What about the deep peroneal nerve? Let's see. This is the deep peroneal nerve. As you can see, it is deep seated into the muscles of the anterior compartment of the leg. It is supplying all the muscles of the anterior compartment of the leg. That means tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius or fibularis tertius. Not only that, it will supply a small part of the dorsum of the foot, which is a webbed space of the skin between the first and the second toe over here. We will see that. So let's see the nerve over here. You can see this is the nerve which is very much deep seated in between the muscles of the anterior compartment of the leg. This is the deep peroneal nerve or deep fibular nerve, and this nerve is passing deep to the extensor retinaculum. But if you can notice, the superficial branch is going above the extensor retinaculum over here. So this is the deep fibular nerve. Now if we see that what are the blood vessels which are present at the anterior compartment of the leg, remember our popliteal artery was present in the popliteal fossa, which was divided into two branches. One is anterior tibial artery, and that anterior tibial artery is present in front of the interosseous membrane. This anterior tibial artery is the main artery supply of the anterior compartment of the leg. Remember, anterior tibial artery, when it goes to the dorsum of the foot, it will continuous as arteria dorsalis pedis. You can see this is the anterior tibial artery. It is present this white color interosseous membrane in front of the interosseous membrane. So this is the anterior tibial artery. We can trace it down. It is going downwards. It is going below the extensor retinaculum, and it will be continuous as arteria dorsalis pedis. Now let's see that how the deep peroneal nerve is going to the foot. You can see this is the deep peroneal nerve or the deep fibular nerve. We already know there its supplying muscles, and over here you can see that it is going in between the tendon of the first digit and the second digit, and it is dividing into two branches to give the cutaneous innervation between the first and the second toe over here. And this one is the superficial fibular nerve. It is actually supplying the other areas. Now self quiz questions. You can see the muscle. One is this one, another one is this one. The first one over here, you can see the name of this muscle is the tibialis anterior, and this tendon is the tendon of the extensor digitorum longus. Let's see. Yes, the tibialis anterior is supplied by the deep fibular nerve, and the extensor digitorum longus is also supplied by the deep fibular nerve. The function is extension of the toes of the second to fifth and the dorsal flexion of the ankle. Now the next question is, what is this structure and what is this structure? We already seen that this is the anterior tibial artery, which is a branch of the popliteal artery, and in the foot it will be continuous as arteria dorsalis pedis, and B is nothing but the superficial peroneal nerve, which is supplying the lateral compartment muscle, that means peroneus longus and peroneus brevis, and also the most of the part of the dorsum of the foot, the cutaneous innervation it provides. Now lastly, just identify these structures. This is the peroneus tertius, a small tendon which is going to the fifth metatarsal. This one obviously B, this is the extensor digitorum brevis. C is extensor hallucis brevis, and D is obviously a tendon of the extensor digitorum longus. Let's see what are the answers. Yes, the answers are correct. So my dear students, we have seen how you have to do the dissection of the anterior compartment of the leg and the dorsum of the foot. We have seen all the muscles which are present over there along with their nerve supply and the blood supply. Remember, these muscles are individually very much important for doing the different kind of functions, and at your exam obviously you have to identify each and individual muscles over there. Not only that, their functions and the nerve supply. In the coming days, we will discuss about the venous drainage of the lower limb. Till then, take care, stay safe. Thank you very much.